participants who are attending this webinar. We welcome you to this live webinar on systematic literature review and meta-analysis. We will be starting the webinar briefly. However, we will wait for some time till all the participants, come and connect with us. So I will be starting it briefly in another few minutes. So today's webinar is focused on systematic literature review and meta-analysis. Now, we have been doing a series of webinars on so many of the topics. And in the last 2 months, the webinars were continuous in the sense we had on research paper writing, publication, review paper writing, and publication. Today's webinar is a different one, and probably it's far more focused than the earlier ones, and we will be focusing on systematic literature review and meta-analysis very specifically. Now, this is a highly specific topic, and thus it has got so much of what you call as much details and focus are on very specific aspects, unlike the previous webinars. So this is a sort of a different webinar than what has been conducted earlier, where we could generalize more of the aspects. Now, this webinar is being conducted by research graduate. So let us talk a bit about the research graduate and what do we do here before we start the webinar. So research graduate is a best PhD and master's consulting company. We help research scholars all over the world with their research work, and we provide a large number of services. Now, the services range from just picking up the topic to writing papers and successfully finishing the thesis. So we not just cater to national students, but also to the international clients. So whether you are in India or out of India, if you ever want any help for any of your scientific aspects, we are here to help you and get your work done. We do the topic selection. So if you are unable to understand what topic you have to pick up and how you have to go on, we are here to help you. We help you with the topic selection. We help you with the topic selection. So if you aren't sure of what topic you want to do on and how you want to work on, then we are here to give you the probable topics from where you can pick up. If you already have the topics, but if you aren't sure of what kind of a proposal you have to make or what kind of a write-up you have to make, we can help you with that. Now, as discussed earlier, we are here to help you with both research papers as well as with review paper writings. So we have done webinars on this in order to give basic idea to the participants about this particular aspect. So we can help you with both at any stages. If you want the complete papers to be written, we can help you with that. Or if you want only a parts of it to be written, we are here to help you out. And for academic students who are like compiling their thesis and trying to make their thesis finish off, if you are not in a position to do that, we are also here to help you out with that. So thesis writing, master's dissertation writing, we can help you out with. And in some of the cases, participants might not need all of this, but they just only need analysis of the data. If it is only analysis of the data also, we could help you out with it. And if all the things are done by you, but you are not able to remove the plagiarism or proofreading or editing you can't do, we could always help you out with it as well. So if there are any other services which have not been written here, but you think we can help you with, you can always feel free to contact us and we are here to help you out. I hope that all the previous webinars which have been done, you have been informative and you have got, sufficient knowledge on the basic aspects associated with it. So we welcome all the participants to write queries to us, or you can give suggestions to us related to any specific webinar topics you want. We shall discuss it out with our team of experts, and then we will decide how we can do and how we could do it out. So here is the contact information for research graduate. You can contact us at info@researchgraduate.com. You have the WhatsApp phone number which is provided here, or there's a dedicated website called researchgraduate.com at which you can post in your queries. So please feel free to contact us. Do not worry or hesitate about whatever is your query. However trivial you think or insignificant you think, it doesn't matter for us. We are here to help you out with it. So please feel free to contact us. If you think you want to have webinars on any of the topics which you are finding it difficult, do send us those queries as well. We will see and evaluate if we can make a webinar on that and help you out with it. We are here to help the clients, and that's our ultimate motto. So please feel free to contact us. Having said that, I would again say a warm good afternoon to all the participants. Please sit back, you enjoy this particular session on systematic review writing and meta-analysis. There is a live question answer session at the end of the webinar. So please don't worry about your questions that you have. Try to focus on what we are trying to say and what we are trying to, incorporate on, and give you an idea of what it is and how it is. So having said that, let us start with the live webinar on systematic literature review and meta-analysis, which is being conducted by research graduate. So even before I start with the webinar, let me tell you, these are the various contents which I would be covering today. Now, one particular aspect which I would be telling to all of the participants, this webinar, unlike other webinars, is more specific. We will not be talking way too much generalized here, and we'll try to focus upon only the specific aspects that are associated with the webinar. So this is a highly specific topic because systematic reviews come under an area which is quite narrow and specific. So we will be focusing on only the related aspects that are associated with this. So today, first we will be talking about what is systematic review writing. Why exactly do you need to write systematic reviews? What is the purpose of this? Then we try to compare, the comparison between systematic reviews and traditional reviews will be done in order to appreciate the features associated with systematic reviews. Then we will discuss about who all undertakes systematic reviews. Is it that everyone can do it, or that they are specific people who do it out? Then we come to various stages which are involved in systematic review writing, which includes how to formulate the research question, how to develop the research protocol, and then how to develop the research protocol and how to conduct the literature search. So we talk about this in detail, how to do critical appraisal and quality assurance of the protocols that we have developed. How do you extract the data? And then following the extraction of the data, how do you analyze it and interpret it? We are going to talk even about the PRISMA flowcharts. What are they and what is the procedure that is followed for this? Then we talk about meta-analysis, which is another aspect which is associated with it. Then what is the significance of meta-analysis? How do you do meta-analysis, and what are the various softwares that are used for doing it? And we talk about risk of bias assessment and how it is done. So it goes quite in details, and for 2 hours, it's a lot of things that we will be covering. So I would request all the participants that you go through this again and again, and if there are queries which you couldn't raise here, you can always ask us back and we will reply back to you. So having said that, let us start with systematic reviews. So what exactly are systematic reviews? Now, Systematic reviews, as the name itself says, it can be split into two parts, the systematic part and the review part. So it's a review like other reviews, but it is highly systematic. You use a highly repeatable analytical method in order to collect the data and analyze the data. Now they are a kind of reviews in which you formulate a research question which is either very broad or which is narrow in scope. You identify the criteria for the study, you extract the data, and you try to answer the review question. While the systematic reviews are often applied in biomedical or health sciences, there is absolutely no rule that it has to be limited to it. Of late, you have systematic reviews in humanities, criminology, justice, and various other related fields as well. Understanding of the systematic reviews and how to implement them plays a very important role in healthcare sector as well as for people who want to make policy making decisions. So thus systematic reviews have a very significant and a prominent role which needs to be understood very clearly. Then here is what is the definition of a systematic review typically as how it is shown. It is a review wherein which there is a comprehensive search for relevant studies on a specific topic. Now this is what the participants have to understand very clearly. It is on a highly specific topic and it's not generalized. So it's a comprehensive search for relevant studies on a specific topic, and those identified are first appraised. You extract the data, you synthesize the data, and then you explain the method. It is an attempt to collate the all empirical evidence that fits pre-specified eligibility criteria. So the whole review moves around one specific research question, and hence systematic reviews, the research question has to have a solid basis. You cannot have a research question which is not proper and you can write a systematic review. We will come back to this aspect of how to formulate the research question after some points where we have slides on it. You are trying to answer a very specific research question and you are trying to give a reliable answer to that question so that it could be helpful for people who are working on it and who are trying to evaluate it out. So why exactly is that we need systematic reviews is a very good question. When you have traditional reviews, what is the necessity to have a systematic review? As you can see here, a systematic review is a reliable summary of otherwise unmanageable amounts of evidence, which we will come back even in the next slide as well. When you have so much of primary data available, and it is so much that it is not possible that you don't know how to arrange it out, then you have to do it in a form of a systematic review. Then the totality of evidence, whether we can generate evidence which has some meaning, whether is there any evaluation and recommendation based on the available ones. This is best explained because on basis of randomized controlled trials which are done for drug studies and others. Every time you have so many trials conducted, what is a conclusion which we get out of all these trials and how it means? Then what is the power and precision associated? That they are systematic reviews are very powerful and highly precise. They are expected to offer benefits and give newer aspects associated with treatment. Then they have to combine results of individual trials in the form of a meta-analysis and tell what is the exact purpose of doing whole thing. So thus systematic reviews offer a different kind of scenario which will be helpful for a specific group of people, and hence you do not have to worry so much about what is called as how and what they are, because they cater to very specific audience. As I was telling you here, there are 20 million citations in Pubmed and approximately 75 to 100 randomized controlled trials are published daily. If you have so much of data which is coming up, it is impossible for any person to sit down and analyze it in one way. Rather, it becomes important that somebody collects this entire primary studies, he collates the observations, makes meaningful statistical data, that's meta-analysis, and publishes a review. So that is where we need systematic reviews. Now, the main advantage of systematic reviews comes out to be for policymakers. As it is said, decision makers require reviews of evidence available. Now, those people who are sitting in the government who want to take major decisions about public health policies and associated ones cannot do it without having a review or summary associated with it. There are thousands of clinical trials which are conducted, and if these trials are the ones which are not taken up properly and not concluded properly, there should be someone who can conclude this and tell you whether it's useful or not. And we need a high quality evidence for making decisions. That's where you need systematic reviews. They are peer reviewed protocols and they are highly unbiased, which tell whether it's a yes or no. For example, if policymakers, now present scenario is like you have the corona or COVID-19 which is ongoing. If a policymaker wants to decide whether a particular drug is suitable for treatment of COVID-19, then you need to have data which is collated and statistical measures which are available which show whether it's a yes or it is a no. That's where when you have to do a systematic review and you have to publish it out, or at least give it to the decision makers so that they can understand that yes, it is feasible or it is not feasible. Now, having said that, what is the difference between a traditional review and a systematic review? Now, traditional reviews give a broad review of a research topic. You collect the interpretation, you conclude it, but it is done in perspective of the author or the researcher who is doing it, which introduces the concept of bias. They are subjected to bias and they are personal opinions which are usually put forth in traditional reviews. Authors describe and discuss the literature from a contextual or theoretical point of view. However, but they don't come back and they try to tell you in general, is there a scope or applicability for the particular review. Now, this is a comparison with terms of various features. Now, when you come to research question, the research question is highly specific in systematic reviews, whereas in traditional reviews, it's too broad. Now, the sources and searches are highly limited in case of systematic reviews, which we will cover in the slides. You don't go through the searches which are so broad, unlike traditional reviews, wherein which you have to collect a lot of it. Here, you don't collect a lot, you collect a little, but you have to expand the scope from there. The selection is based on so-called criteria, which are known as inclusion and exclusion criteria, which are not existing for traditional reviews. You have to do critical appraisal of the review, which is done in systematic reviews, which does not exist in traditional reviews. The data synthesis and extraction methods are different for systematic reviews. Here, in case of traditional reviews, you just look at the data, you do a qualitative assessment, you don't do quantitative assessment at all. The inferences and gradings are highly specific for systematic reviews, which is not the case with traditional reviews. Now, a traditional review does by far are maximum published. However, systematic reviews are a subset of the total reviews that are published, but are highly specific, and they are not like traditional reviews because you have to focus in a very different manner and you have to do it out in that way. Now, here, having said that, when you are talking of systematic reviews, there is a method by which you collect the data. And so there exists what is called as hierarchy of evidence. If you see this pyramid, systematic reviews sit at the top of the pyramid. You start with editorials and expert opinions, which are of the least interest in collecting data for systematic review. Then you go to case series, case reports, case control. You go for case series, case controls, and then you go for what are called as cohort studies. When you say a cohort study, cohort is a group of highly identical people with similar disease functions. Then you do randomized control trials. So you collect data from all of this and then you write the systematic review. And hence it becomes out that systematic reviews fall at the top of the pyramid. Then, having said that, who performs the systematic literature reviews? Systematic literature reviews are not conducted by regular people. They are conducted by clinicians, they are conducted by health service researchers, by statisticians and information scientists and health economists. Patients and public involvement is there only to give guidelines for it, otherwise, they can't write it. Systematic reviews are usually written by experts who have an idea of how to write it and how to work out with it. And hence, they are like very, very specific. And you have to work out based on the specific aspects associated with it. Now, having said it, systematic reviews are written and published by selective group of databases which are dedicated to it. We are going to talk a bit about these databases here because they have well established protocols which could be utilized for writing and working out with it. The first one such example is the Cochrane Library. It is a part of the British Medical Journal Publishing Group. It has access to the various Medline and Embase databases, and it has access to various of the clinical trials. The advantage of the library is that it has articles listed and recognized as controlled trials or systematic reviews. It has dedicated protocols which you have to utilize for writing it. There is no bias in Cochrane Library because they already have softwares to check for bias. Then they use MESH plus keywords, which I will be talking about what it is in the later slides. Now, they mainly cover clinical medicinal chemistry that is mostly associated with health field. Now, it's one of the best databases which is available for systematic reviews in order to read and in order to publish it. It's updated quarterly and it has a lot of value. In the field of systematic reviews, Cochrane systematic reviews are undoubtedly the best which are used. Now, the Cochrane Library collection is a collection of evidence-based medicine databases. If you can see here, it has a collection of 6 of these databases, which include Cochrane Database of Systematic Reviews, the Cochrane Central Register of Controlled Trials, the Cochrane Methodology Register, the Database of Abstracts of Reviews of Effects, Health Technology Assessment Database, and NHS Economic Evaluation Database. Apart from this, it also has information about Cochrane Collaboration and Cochrane Collaborative Review Groups. Thus, it's very, very broad. And this is one of the most dedicated sites, which is, which is mainly influential in collecting the systematic reviews and in publishing them as well. So having said that, the next one is Campbell Collaboration. Campbell Collaboration is a sister initiative of Cochrane. It's a non-profit organization that promotes evidence-based decisions and policies through production of systematic reviews and other types of evidence-based synthesis. Now, the Cochrane Collaboration publishes systematic reviews as Campbell Systematic Reviews. It's an open access journal which publishes research papers, evidence, and gap maps, not just in the field of health sciences, but even in other fields such as criminology, justice, humanity, and others. It has multiple groups in it which coordinate the production of systematic reviews and evidence gap maps in diverse areas. Now, this is the introduction to the Campbell Collaboration. Systematic reviews of the effects of social interventions is one of the aspects which it deals with. It has reviews in education, crime, justice, and social welfare. It registers relevant reviews, links to useful methodology sites as well. So it is a sister concern of Cochrane, and so you will get it along with Cochrane, the Campbell Collaboration so available. Then the next one is Embase. Embase is Experta Medica database, which is dedicated for biomedical and pharmacological bibliographic aspects. So it talks about pharmacovigilance and whether the drug has effect, the kinds of clinical trials which are done and how they are managed. Embase is published by Elsevier and it has 32 million records from over 8,500 published journals since 1947. MBase and its sister concern M-Tree enables tracking and retrieval of DUG information in published literature. It has access to so many of the clinical trials and biomedical journals across 95 countries and is available through a number of database vendors. And hence, Embase is one of the most widely looked after ones apart from Cochrane in terms of systematic reviews. Now, Medline, as it stands for, is Medical Literature Analysis and Retrieval System. It is a concern, it's a sister concern of NLH, or the National Library of Humanities, or the National Library of Medicine that you have. It's freely available on the internet and searchable via Pubmed as well as via NCBI. Now, it covers medicine mainly, which includes medicine, nursing, pharmacy, dentistry, veterinary medicine, and healthcare. And all of them are worked out very properly here. Then, if you look at Embase versus Medline, now this is the coverage. The bigger circle is Embase, which has 2,500 journals, and many of them are available even on Medline. They are, and you can see here that it has 8,600 journals and 32 million records. In-depth device indexing, which is greater, more than twofold when compared to Medline. It has much more unique search features. It has ability to save, share, and edit much more frequent, much better than Medline. And it has much more non-English based clinical trials as well as publications when compared to Medline. And hence Embase does is much far broader a database which could be utilized and which could be used out for systematic literature review analysis. Then there's another one which participants might come across called Prospero. It is Prospective Register of Systematic Reviews. It's better known as Prospero, which is an open access online database of systematic review protocols. Till 2021, it was only associated with publishing medical field associated reviews. However, now they have started protocols in criminology, social care, education, and international development. Researchers can register their protocols first with Prospero and then, if validated, can publish it. The database is produced by Center for Reviews and Dissemination at the University of York in England, and it is funded by National Institute for Health Research. So thus, it is a very dedicated site as well. Now, having said it, I have given a brief idea about what are the databases which are dedicatedly available, wherein which you can register your protocols and you can work out with it. So now we come to key stages which are involved in systematic literature review. The three most important steps that are involved includes you plan the review, you conduct the review, and then you report the review. So when you say you plan the review, you formulate the problem. Formulating the problem is nothing but developing a research question. Then you develop an appropriate protocol as how you will identify the studies and answer the research question. Then you conduct the review, in which you search the literature, you screen for including the articles, you assess the quality, you extract the data, you analyze and synthesize the data. Once you are done it, you interpret the results and you report the data. Now, these are the steps which are followed for systematic literature review at any given time. We will be covering many of the aspects associated with it and try to explain how you work it out and you do it. Having said it, let us start with systematic review writing. What is the procedure, how you do it, and how you go with it. Now, this is actually the systematic literature review writing is a huge process. The process is it's not that it is very cumbersome, but it is tedious in terms of the way you interpret and work out with the data. Now, as you can see here, first and the foremost thing is you have to formulate the research question. Once you formulate the research question and you know what you want to work on, you design an appropriate search strategy. Then you write the protocol, you register the protocol and get it validated. Then you start searching the appropriate bibliographic databases for literature identification. You get the papers. Once you retrieve the papers, you go for identifying the inclusion and exclusion criteria. Once you have got the papers that you need, you extract the data, you do a quality appraisal of the data and then critical appraisal of the data that's extracted. Then you formulate the research and or the policy, and then you do the conclusions. So this is the overall flow chart for the systematic review process. And that is how it works out with, and that is how you go with it. Now let us look at in detail for each of them as how you do and how you work it out. Now, as said, the formulating a research question is a basic step for starting the systematic review. So what is that you want to do? Now, as it has been put forth here, most important, first you have to identify is what are the study objectives. So you want to look at a larger population. So what is that you want to look at? Now, one of the best examples here, if you go through any systematic literature reviews, is you want to look at the effect of an anti-cancer drug, whether it can cure cancer in patients. So that will be your study objective. So you are looking for the effect of anti-cancer drug in the population. So then you try to create guidelines for studying this. Then what are the various operational definitions that you put forth when you are studying it? As I have said, the disease or condition of interest is you are looking for cancer. So what kind of a cancer are you looking for? Is there any specification? Then what population and setting are you looking for? That's another aspect. Then what kind of a treatment are you looking for, intervention or exposures that you have here? Like, do you have any risk factors? Is there any medication which is preventing it from happening? Are there any diagnostic tests that we can look at? And what are the outcomes? Outcomes in the terms of, if you are doing the treatment, is it helping to control the cancer or is it not helping? Then what kind of a study are you going to do? Are you going to do a randomized clinical trial, or are you going to do a highly specific clinical trial? Then what kind of observational studies and models which you follow? This I will be covering in the later slides. All these are required to be enumerated, based on which you have your so-called what do you call as you have so-called formulation of the research question when you are doing. Then based on that, then these are the three aspects to be considered. First, you identify the question. The question could be either very broad or it could be narrow. Discuss potential limitations for each of the question, if it's a broad one or a narrow one. Now, if you have a time limit and if you have limit for the resources, then you try to see how you work it out. But if there is no time limit and low limit for resources, then you see how you can frame the question. So the question splits out as whether how much time and how much resources you have. If that is not a criteria for consideration, you can frame the question broadly. Otherwise, you might have to narrow down on the question and work out appropriately. Then you have to look at advantages and disadvantages of both the broad and the narrow questions. For example, if the question is a broad one, like as how I said, the effect of treatment with a drug in cancer patients, what kind of a comprehensive summary will I get here? Whatever summary I get, can I generalize it? Is it possible that I can generalize it and get out with a conclusion? But however, if the question is narrow, like I am looking for the effect of the drug on treatment of anti-cancer in only in ethnic populations such as Africans, it is too narrow a question. So you have to think, if you are questioning in such a narrow manner, as will you get sufficient evidence to make the review? If you get evidence to make the review, will it be useful? And will I get any generalization from the findings I get? So based on which you have to finalize the question as whether it could be suitable in the broader manner or in the narrow manner, and you could work it out. Then here are the points which have to be considered when you have to finally decide as what kind of a question will you land up in, the broad one or a narrow one. These are the aspects to be considered. What is the impact of the study that you will give? Does the question have relevance? If it has relevance, and what is the impact? Now, what is the supporting theoretical, biological, and epidemiological information? Is it already existing? Can I use any supporting information for it? What kind of a generalization and validity can I make out from the question? What are the available resources? Are they sufficient enough or we need more? Has a systematic review been done already in the existing part? Or if it is not done, then you can publish it. If it is already done, is it how different when compared to that? Because if it is not much different, then there is no scope for publishing it. All these points have to be worked out while framing the research question. And hence, when you are talking of framing the research question and trying to work out based on framing the research question, you have to do all this working out, which is not done in a traditional review. There, the research question can be as broad as possible and you don't have to worry. Here, you can't snap up at the end of the day and you have a what do you call a review, systematic review return, but it doesn't make sense as such. Now, you have to develop a specific research protocol when you are trying to work out and understand it. Now, the first step in the research protocol is having an introduction. The introduction, unlike traditional reviews, you don't write a broad introduction having all the background and other things. You do an introduction wherein which you describe the rationale of the study. You talk about the objectives associated with the study and the various definitions that you are using for understanding the study. Once you put forth the introduction, then you have to include the methods section. Methods section will include, most important is the inclusion and exclusion criteria. Let me tell you for all the participants that when you are writing a systematic literature review or a meta-analysis, the inclusion and exclusion criteria are the most important filter based on which the review is either accepted or rejected. So you should have a strong filter for inclusion and exclusion criteria. Now, the various sources that you use, like you have the databases and others and the grade literature, we will be covering these in the next slide, so you don't have to worry. I will talk about them in detail. Then you have the search strategy. What is the exact nature of the search strategy that you have? The study selection process, which includes whether you agree with some of the aspects or you disagree with them. Now, how do you manage the data? You have to describe it. How are you collecting the data? How are you assessing the risk of bias and how you are doing data synthesis? All of these have to be put forth in the methods clearly and worked out in a proper manner. Till then, you cannot do any specific aspect. So it's like you have to develop the protocol completely and say it out. So when you do the methods section and when you are working out with the protocol, one of the important aspects associated with systematic reviews, you have to register the protocol. Now, why you have to register the protocol? It is because you want to get a validation of your protocol that it is correct for whatever you're conducting your review. And secondly, if you register your protocol, then there is more transparency. Researchers around the world know that you are working on it, and hence they will not work on a similar systematic review. Now, a protocol, when you are registering, will have a conceptual discussion of the problem and will include the various aspects which we are going to discuss below. It should have the rationale or background of the study. It should have a definition of the subjects and topics. Then it should have the potential contribution of the review to clinical decision making. Now, so most important, whether when you write a traditional review or systematic review, is it contributing anything or you are just writing because you want to write it? That's important. And particularly in systematic reviews, it is important that it has a significant contribution because it has to go for decision making. Is there enough relevant literature to merit a systematic review or meta-analysis? And then what are the inclusion and exclusion criteria? All these have to be given very clearly in the protocol when you are registering it, because if that is not done properly, then you don't have any aspects associated with it. Then while registering the protocol, you should include the following. One is PCOS of interest. PCOS stands for population, intervention, comparison, outcomes, study types to be reviewed. All this have to be put forth very clearly. Then, what are the sources that you use for literature? The screening methods, which includes the inclusion and exclusion criteria, the data extraction methods, the methods to assess for bias, and the contact details of the authors who are doing it. So first and most important is that you just go ahead and you put what is called as you register your protocol. and you wait for it to be validated. Once done, you can go ahead and do the literature search for the systematic literature review writing. Now, where do you register the protocol? The protocols are registered and subsequently published in Cochrane. The Cochrane database is for health sciences. Then Campbell Collaboration, wherein which you could do for any of them which are listed here. Then Collaboration for Environmental Evidence, which is for environmental issues. Open Science Framework is multidisciplinary. And Prospero, which not just covers health sciences, but others such as health and social care, welfare, education, crime justice, and international development. I understand that there are a large number of participants which are even from the non-science background, and hence you can also find many of the databases which cater to them, and that could be helpful for you to register your protocol. So what exactly are the inclusion and exclusion criteria? Now, once you have a research question formulated, the authors must come out with a definitive list of inclusion and exclusion criteria. So when you talk of inclusion and exclusion criteria, the best method I will give you here, an example is that you are talking of the effect of a drug on treatment of lung cancer. Now we are talking here that tobacco causes lung cancer. So we are looking for, our one aspect is how much does tobacco influence in causing lung cancer. So the inclusion criteria here will include all the papers which have material available for tobacco and lung cancer. But however, tobacco can also cause oral cancer and other cancers. So your exclusion criteria automatically becomes those which have tobacco with non-lung cancer associated papers, which you will remove out. Now, this will help in avoiding the selection bias. Inclusion and exclusion criteria should be agreed upon and formalized before data extraction and analysis. Now, this is the most important part. So if you don't want, before you start extracting the data and synthesizing it, you need to have a clear cut inclusion and exclusion criteria without which you cannot work out. Then with that, I can introduce you to the PRISMA statement or PRISMA flowsheet. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. This is a highly standardized method for reporting it. In any of the systematic reviews, the first figure will be from PRISMA statements only as such. So, without the PRISMA statement, you cannot have anything done. So the PRISMA stands for Preferred Reporting Items for Systematic Reviews. It's an evidence-based minimum set of items for reporting systematic reviews and meta-analysis. It has 27 item checklist and a 4-phase flow diagram. Many of the participants might have just seen it at times when they are studying about, this, which I'll be putting forth in the next few slides. We will explain how to report it out as well. PRISMA is the recognized standard for reporting evidence in systematic reviews. The benefits of PRISMA, because it's a standardized and agreed protocol, when you put it forth, you are done with it. You can demonstrate the quality of review by having a PRISMA flowchart. It allows readers to assess the strengths and weakness of it, and it's a standard structural format on basis on which the reviews are published. Now, how exactly are the PRISMA statements? Here is how is the PRISMA statement. Now, this flow chart, many of the participants might have seen. As you can see here, records identified through database searching. Then you have records identified through other sources. Then you remove the duplicates and show the number of records. Then you screen out records which are to be excluded, and you use multiple criteria here, and finally you have the studies which are considered. The next 2 slides have examples for how it is made, as you can see here. For example, now for the identification in this study, a total of 97 records were identified, of which when you remove the duplicates, on 92 were there for screening. Of the 92, 28 of them have been removed, and the reasons have been mentioned here, that they did not offer proper guidelines, or it was not in English, or it was outdated, or the review didn't have the specific topic, and so on. Then, if you remove 28, the full length articles assessed for eligibility is 64, of which you again have removed some of them based on the reasons provided here. Then you have included 46, and you have added additional records through forward backward searches and additional methods and example papers. So a total of 99 have been considered for the study. Now this is how you make the PRISMA statement. You put forth the exclusion criteria, which finally tells you how many are you considering for the particular aspect. Another example which you can see here, a total of 370 articles have been collected from various databases. 28 have been removed, and so you have 342, of which 247 have been rejected because either they were not relevant or they did not have the search criteria that's required. Of the 95, again you have removed 74 based on these reasons. So you are left with 21 articles, of which you have rejected because they are not full text, and so you have only 17 left. Of the 17, you have rejected some more again as such, which includes a 6 here, and finally you are left with unique studies, which are 11. Now, so this is how you generate the PRISMA statement. You don't have to generate it. You go to the database, you download the form, and you fill up the boxes, and you make the PRISMA statement. Once you make the PRISMA statement, you just can upload it along with your protocols. It will give you a clear idea of your inclusion and exclusion criteria associated with it. Then you come. So with this, we cover the basic aspects as how to formulate the research question, how to develop the research protocol, and how to report it. Now, once this is registered, and after registering the research protocol, you have found that this particular research protocol is validated, then you go ahead and do literature search. The literature search is for various studies is done from 3 sources, which includes electronic sources, print sources, and gray literature. Electronic sources include databases, electronic libraries, and internet. The print sources include journals, textbooks, and hand searching, and the gray literature includes databases, conference proceedings, and research funders. The word gray means something which is not associated with either electronic sources or with print sources, but it comes from other sources as such. Now, when you are doing the literature search, the source or the evidence is collected from various databases. The core databases that is used for collecting evidences for systematic reviews includes the Cochrane database of systematic reviews, the database of abstracts of reviews of effects, the Cochrane Central Register of Controlled Trials, Health Technology Assessment Database, the Medline, MBase, and CINAHL, which is Cumulative Index to Nursing and Allied Health Literature. So you use all of this as a source of evidence, and you collect the data and literature from here. Now, if you can see this Venn diagram, the bulk which is coming out is from Embase. It's European one, but it has a huge collection. The Cochrane Library is another collection which becomes a part of Embase. Then you have other ones like Medline has collection of various others other than the clinical trials, and hence this excludes the other part of it. Then you have got so many of them like CINAHL, then nursing at Ovid. Then you have IMCare as well as Australian databases, which can be seen here. But the most or bulk of it comes from MBase very specifically. So, having said that, now you want to do literature search from any of the databases. You have to give the keywords and terms for literature search. So with this, we introduce you to MESH, which is called Medical Subject Headings. It is the National Library of Medicine's Controlled Vocabulary Thesaurus. Now, this particular one, whenever you publish a paper or an article, the MESH terms come by default. If you use those MESH terms, it will be very useful for you for indexing the articles either in Medline or Pubmed database. Each article citation is associated with its own set of MESH terms. If you can search using these terms, you will get the relevant citations, and your life becomes easy when you are looking for it. You can always use the keywords, but this also makes much more prominence and importance. Now, Having said that, the applications of MESH include literature search and information retrieval, citation analysis, training, education, and bioinformatics research. Thus, it's very broad and has been developed by PubMed in a beautiful manner so that you could utilize it out in a very successful way. Now, the MESH words can be found in PubMed. So when you are looking for articles in the PubMed, at the end of the page, you get these options for learn, find, download, and explore. In the explore section, you have MESH database, which if you can click on, you'll get the various MESH related terms which come up and which are useful as such. Now, I will give examples for MESH keywords and terms which you can use here. If you are looking for words associated with AIDS, you can give different manipulations here. Like you can give it as acquired immunodeficiency syndrome. You can give it as acquired immunodeficiency with a hyphen or a space, or you could give it as acquired immune deficiency. All of these are variants for the same one, which if you type will get the terms. Now, sometimes you have synonyms for a newborn, the terms like infant, toddler, baby, etc. Plurals like for child, it's children, or for teenager, it's teenagers. Spelling variants based on UK and US, like randomize for S and Z. These are the variants which highly exist. So sometimes you feed one of them, you don't get it out. Sometimes when you feed the other, you get it. So you have to try various variants. Otherwise, you look for the keywords in the PubMed and you'll get the MESH thesaurus, which you could utilize for working it out. Now, another example which has been put forth here is for the search terms and how many records you get. For example, the word biomaterials, when you put it as a keyword, you get a record of 1,42,000. When you use cell scaffolds, they are also a keyword, you get 29,892. All others are MESH terms. And if you see, when you put a MESH term, it also covers the keywords and you get a lot more of them which are coming up as such. These terms are specific and will be highly useful for retrieving the citations, whatever are required as such. So in that way, it is very helpful. Now, with that having said it, this when you are doing keyword search, there is what are called as Boolean operators, which are very useful while searching. They are words that connect search terms to create a logical phrase that a database can understand. Now, when you are doing complex searches, the use of Boolean operators helps you to simplify your search, and so it are help this. Thus, it is very helpful. And or not are the most commonly used operator terms in Boolean operators. Most library databases are designed to work with Boolean operators. Search engines such as Google and all other engines have access for Boolean, or means they use Boolean operators for searching it out. I will give you an example corresponding to this is how. So for example, you want to look for papers wherein which you want to see the role of aspartame and whether it causes cancer. When you are using the term aspartame and cancer in this Venn diagram, this is aspartame, that is cancer. So the common ones are only in this common area of the Venn, which you can pick up and use, which you can use for retrieval. If you use or, like aspartame or saccharin or sweetener, for example, in this, like they are all sweeteners only, you will get saccharin as one circle, sweetener as one, and aspartame as one. The common one to all the three of them has to be retrieved. So when you are using or, you are getting too many of the combinations. So you have to look for a combination which is common to all of them and you have to retrieve it. And when you use not, it excludes records that contain a given search one. Like as you can see here, AIDS not hearing, it retrieves documents with AIDS excluding anyone which does not contain hearing, and hence you'll only get that specific set of it. Thus, Boolean operators are very useful when you are doing in any of the cases, and using such terms will help you to overcome many of your hurdles when you are using it. Boolean operators can also be used in traditional reviews, but when you are doing reviews for systematic, they are also equally helpful as such. So having said that, now we come to the aspect associated, which is the selection of the studies. So how do you select a particular study? Now, when you are selecting the studies, you, as I have shown in the PRISMA flowsheet already, you exclude, first you give the keywords and terms and you pick up the articles. Then you go through the titles and abstracts. If they are matching, you pick them up. If not, you don't. If you are in doubt about the titles and abstracts, then you could go ahead and you can, work it out with your predetermined criteria. Then you just include it and you see later. Then if they are matching with your titles and abstracts, then you go to retrieve the full text article of the selections. However, when you are doing for systematic reviews, whether an article has to be included or it is not included for the selection will not be decided by a single person. It is decided by more than one reviewer. So you always have more than one people who will tell you whether it is fine or is it not fine. So you use the reviewers, then you come with them, you discuss it out, and then you pick up the ones which are more consistent and have decisions that are required as such. So thus selection of the studies becomes a very critical aspect. Once you select the study, you have to extract the data. Now, extraction of the data is dependent upon the research question. You have to be very clear as what you need. Once you have identified the literature, you have to identify the various study details that are required that you want to put forth. Collect the information regarding from the literature regarding what is the methodology that is followed by them, what are the population groups that have been used, what are the interventions. Like you have, when they are doing usually for drug treatments, you have different kinds of interventions. When I say interventions, you have people who are who are only suffering with the disease but they don't have any other pre-existing conditions, people who are suffering with the disease with pre-existing conditions in which you can have multiple of them. Then you have to compare those interventions and you have to evaluate the outcomes. So for each literature that you collect, you have to do all of this and you have to put it out, and then only you work it out properly. Then what is the extent up to which you collect the data and you utilize it? The amount of data that needs to be extracted depends upon the judgment of the researcher. Now, it is up to the researcher that he decides what is the amount of data that is required. Now, when you are talking of the judgment, the following points have to be considered. You have to collect sufficient data such that it describes your study, and also that you have to collect that much which is enough for you to undertake the planned analysis. You should collect it in such a way that you don't go back to the paper for collection. You collect all the relevant things so that you can use for graphs, you can use for drawings, and you can work it out appropriately. However, most importantly, it is essential not to include unnecessary details as it makes the review not very appreciative. Always remember that systematic reviews, unlike traditional reviews, cannot have literature review and all written there because that is not important. We are collecting the data and we are working out based on it. So in that way, if somebody wants to appreciate the data you have collected, it is essential that you don't write too much of a background or do collect too much of data which is not relevant as such. Then, when it comes to data extraction, here are the following points which one has to consider and one has to see as how it is. Now, what are the various effects and measures that you are considering and calculating for the study? Are those effects and measures there in that literature which you have collected and you say can be included? Now, then the other point that you have here, is that um, identify if the other point that you have here is that you identify if there is data corresponding to your particular aspect that you are working on or that you are talking of. So when you say about this, what I mean to say is that, so you have the literature already collected and you have the data from there you are extracting. So is this data suitable for my work or not? Now, whatever is the data that has been collected, does that help in understanding the related aspects that are there? What is the nature of the data that has been collected in the literature? Is it based on the intervention or is it based on the study? If it is based on the intervention, how they have done it? If it is study design based, how they have done it? So you have to talk about it. Then whatever is the information you are looking for extracting, is it there? Is the information properly organized and analyzed for it? So that also you have to understand. It is essential to remember that research protocol, whatever is there, has to be followed. Now, whenever you're collecting the data and you're trying to extract it out, please go back to your research question and try to understand if that you are trying to answer the research question that you have said. Are you trying to meet the inclusion and exclusion criteria for it? That is the first thing. Apart from that, another important aspect that you have here is that, is the nature of the information that you are collecting, is it relevant for you to do your work? If it is not relevant, then that such a data has no meaning as such. So you have to think about it, and it's on the basis of that you try to collect the data. Now, however, as I have said, when you are writing systematic literature reviews, you don't have to do a lot of your own work. They are softwares and they are tools which are available, which you can widely utilize for writing these. They are softwares available for data extraction as well, which could be utilized and done perfectly. So when you talk of the softwares that are available, you have for Word, Excel, and three specific softwares, which is the EPPI Reviewer, the Covidence, and RevMan. Now, Word and Excel are for manual extraction of the data from published literature. Of course, you have some of them wherein which you have add-ons to Excel, wherein which you can do systematic literature analysis, which I will come back later. But generally, this is how it is. We will discuss about the other three ones which you have, like EPPI Reviewer, Covidence, and RevMan, and try to understand what they are. So first, let us come to EPPI Reviewer. Now, EPPI Reviewer is the Evidence for Policy and Practice Information and Coordinating Center. Now, that's a full form of EPPI. It is from University of London and established by Social Science Research Unit. The main purpose of EPPI is to collect literature regarding systematic reviews and to collect the various protocols associated with them and help to organize and publish them. It is a web application that enables researchers to manage the entire life cycle of a review, as it has been said. Users, what they can do here is they can upload their protocols, they can upload their data, their analysis, and all other aspects to EPPI website. Then you can do automatic analysis. EPPI helps in meta-analysis, in summary tables, as well as in support for qualitative synthesis. Thus, it's a very useful software which is available with them. So you can go feed in all the data, extract whatever you want, and then you can make conclusions based on it. And in that way, there is no problem with EPPI Reviewer as such. Then the next one is RevMan, and next one is Covidence. Covidence is other nothing but co-evidence. It is systematic review production tool. Right from making the title, abstract, screening the tests, getting out the data that is required, and doing qualitative assessment, everything can be done from Covidence. Now, when we talk of Covidence, Covidence was designed by researchers who are associated with Cochrane authors. Now, these people are the ones who have been working with Cochrane authors, and so they help you in order to, write proper systematic reviews. It was developed by North Carolina Chapel Hill. It helps in creating, publishing, reviewing, and updating the data. In that way, it is very, very helpful as such, and helps us to, extract out all the ones and get things going. Then the next one that you have is RevMan. RevMen is official tool of Cochrane Collaboration for systematic review analysis. It's called Review Manager. This is my personal favorite. When I worked on the systematic review, I used RevMen because it's a free internet tool which you can download onto your desktop and you can work on it. It helps you for preparing full systematic reviews, helps with the text, studies, drawing graphs, tables, and whatnot, everything you can do with it. In addition, RevMen is one of the tools which will help you to do workout with the risk of bias assessment, and it helps you to tell whether this one is suitable or not. So RevMen is not just for systematic reviews. You can also do diagnostic test accuracy studies. You can review the methodologies, and you can do umbrella reviews. When I say umbrella review, it means you can write a review of the existing reviews as such. Now, a bit on the reviews. When I was doing the review paper publication webinar, we have covered about the various kinds of reviews. So you can look back at some of the webinars, and you'll get idea of what are umbrella reviews and other kinds of reviews as such. Now, having said that, once if you are extracting the data using any of the tools that you have to do what is called as the assessment of the data, extracted data. You need to see if there is a consistency, if the data is sustainable or is not sustainable. Now, this is very important because if it is not consistent or sustainable, then you will get multiple conclusions which do not make a meaning. Usually, systematic review is not written by one person. It is written by multiple people. And when multiple people write systematic review, all of them should be on the same page to reach the same conclusion. So it is essential that you have more than one reviewer who's extracting the data. The various reviewers are interpreting the data in same way, which should address answering the research question. Then independent piloting of data extraction form. So when multiple individuals are doing this analysis, all of them should fill up one standardized form which will give a uniform conclusion. Then if there are disagreements associated with it, they have to be sorted out and the progress has to be checked. Regular comparison of data extraction has to be done. You can't wait till the end and you can compile anything and put forth for a systematic review. And hence, consistency or sustainability in the extracted data becomes another important aspect which is associated with it. Now, here are the most important key takeaways for data extraction. Most and the important key takeaway is it is based on the research question that you have raised. The research question that you have raised should be the one based on which you do it. You have to use a specific software for proper and logical data extraction. You do not collect extra data as it has no meaning like traditional reviews. The data should answer the research question very, very clearly. You have to categorize the data properly so that it is logical. Adherence to the review protocol is the most important aspect for data extraction. So here, when I'm explaining to you about the literature review, I'm going in steps. First, you are writing the introduction. Then you are making the protocol. You are registering the protocol. You are getting it validated. Then you are doing the literature analysis and you are doing the data extraction. Again, once you are doing the data extraction, you are using softwares for extracting it and you are checking the credibility of the extracted data. So participants should understand this flow through which I'm trying to tell so that they can appreciate the overall presentation and can take key takeaways home from where they can do the systematic literature review writing. Now, as it is said, once the data is extracted, you have fed it into the tools, you got out the relevant data, you have to do what is called as the quality assessment for the data. So whether the data has got quality, which is sufficient enough for publication, or it doesn't have. Assessing the quality of evidence within a systematic review is important as analyzing the data within. Now, it's not just analyzing data, as aptly I have put forth in the statement here. It's not just with analyzing the data. If it is of no good quality, then it cannot be considered at all. Now, then, if the results are conducted or obtained from poor quality data, your review is out to be rejected immediately. You cannot have biases when you are doing the systematic review. A biased systematic review is outrightly rejected. I will talk of risk of bias at the end of the presentation, so you don't worry about it. Now, such studies which are poorly written and have a bias cannot be acknowledged, and so you have exclusion. So what is important is you have to select appropriate tools to help to analyze the strength of the evidence and remove the bias. So always remember that in systematic review writing, it is the way you write is not the point alone. The way you have presented it is very important. Your whole presentation will have all the details, and hence it is better you write systematic review through an established tool which is already present. Then they will help you with all the quality assessment and various other aspects also as such. Now, there are several of quality assessment tools which are available online nowadays, which you can use. I have listed many of them for the participants so that it could be helpful for the wide coverage, because as participants are from different backgrounds here, you can get across with many of them. Now, one of the most widely used ones is AMSTAR2, which is assessing the methodological quality of systematic reviews. You feed your data and you try to assess whether the data has got good quality or not. The other one is a Cochrane risk of bias, or it's called ROP2 tool. It's a recommended tool for assessing quality and risk of bias. Then Center for Evidence-Based Medicine is another one. Then you have Critical Appraisal Skills Program, or CASP. Now, Critical Appraisal Skills Program has immense experience, as it is mentioned here, of around 25 years, by which they can assess the quality of the data that you have, and then they can tell you whether the data is worth the publishing or not. Now, apart from that, you have other ones such as Joanna Briggs Institute, the National Academy of Sciences Health and Medicine Division, the Newcastle Ottawa Scale, the Quality Assessment of Diagnostic Accuracy Studies, and STROBE. So, a complete list of them is not a requirement. I put the major ones which are here. It is not possible to discuss each of this in detail as it is beyond the scope of this webinar. So I would request all the participants that you can pick up by any one of them, whichever is relevant to you, and you go to those sites, study, understand the instructions, and feed your data. Then it will become easy for you to assess it. Now, next comes the question of critical appraisal. So what exactly is critical appraisal? Okay, you have extracted the data, you have assessed the data, so you are getting out conclusions with the data. So your particular entire aspect, including protocol, data extraction, and others, when you feed it, it needs an appraisal. It has to be critically evaluated to say whether it is worth publishing it or not. So here are the questions which are considered for critical appraisal, which include: does the review have clear objectives? If it doesn't have, then it's of no use. Are the methods for inclusion and exclusion criteria clear and adequate? Have you defined the criteria clearly or not? If you have not defined them, then it's of no use. Then the various studies that you have collected for data extraction, are the studies of good quality or not? Have you critically evaluated the study to understand its quality? Are the results reported in an organized and structural manner? Is there appropriate analysis and presentation of the results? So it's not just having the results, it's with the presentation of the results. Have you done it properly or not? Have you interpreted the data properly or not? Does the data have any future significance? Is it helpful for the clinical researchers for proceeding to the next studies? As like a traditional review, if the systematic review has no application, then it is of no use publishing it. So thus, it becomes important that you consider all these questions for critically appraising the data. And if anywhere you find that it is not matching with this, then you are at loss. You can't publish it. Now, let me give tell one thing to all the participants who have come to attend the webinar today, that systematic reviews are highly specific. It looks like it's only a small selection of papers which you are using and doing the review, or highly specific papers. But when you feed into these tools, you will understand that they are all these whatever I'm discussing, which have to go step by step. Only if it's evaluated perfectly by that manner, it will be considered for a perfect selection, and it will be considered for publication. So all these parameters have to be considered, and there will be filtrations which are associated with it, only based on which you can go ahead and publish it. So after you have done the data analysis and no data extraction, and then you have done the quality assessment, you now formulate the data, which comes as data synthesis. Now you then consider the results from different studies. Now there are 2 points here. Okay, you have data from n number of studies after all the filters that have passed through. So does this data have got any statistical analysis? If it has, it becomes a meta-analysis. If it doesn't have, then it becomes a narrative summary, which is a classical systematic review. Now, heterogeneity is a very important feature which is associated with systematic reviews. Now, when you have a large number of studies done by different groups, there are always differences existing between the studies. The differences appear from different aspects, which could be because of the study design, because of the population size, or because of the parameters or interventions which are considered. So a systematic review should give the reasons for heterogeneity and should get all the studies together in one umbrella. So why exactly are the differences arising? What is the reason for it? There should be a justification for it. So because they are so different studies which you are putting together in one, like an umbrella review, you have to give clearly, though the studies are different, what is the common thread that is linking the studies, and how is that this thread is helpful for understanding it. So thus the source of heterogeneity and why it is has to be explained when you get out with the data. So when you get out with the data, you organize the data, then you give reasons for heterogeneity, and you support your research question or your research claim. So that is how you do a systematic review. So as I have said, the systematic review goes in the steps, right from formulating the research question to making the research protocol, registering the protocol. Post registering the protocol, you go to the next steps of doing the literature analysis, getting out the selective studies based on the validation of the research protocol, which is registered. Then after that, you go ahead and you explain about how you are getting out with the data. You extract the data, you validate your data extraction protocols, you do the quality and credibility assessment, then you synthesize the data and you summarize it. Now, this is how you write a systematic review. If you consider it with a traditional review, it is so different, that because in traditional review, you don't have tools where you do all these evaluations. These are very specific, and thus systematic review becomes so specific that it is not just for anyone. It's not everyone's piece of cake. You need experts to do it. Or if you are writing for the first time, you have to go through the guidelines. You have to download systematic reviews, read, understand, and analyze them, only on the basis of which you could go ahead and get it done. Now, that is how it is. Having said that part, now with that, we start with the second aspect, which is meta-analysis. Now, meta-analysis, as defined, Glass was the first person to have defined meta-analysis. He defined it as the statistical analysis of a large collection of data from individual studies. Now, which is so apt. You have so many individual studies which have been done, and there is so much data collected. You are trying to collate the whole data into simple statistics and get an idea of what it means, how it means. So that is what is meta-analysis. Meta-analysis is highly quantitative, it is formal and epidemiological study design. and it systematically evaluates the previous research and tries to give a conclusion based on the research. Okay, so I have said 15 to 20 papers in which you have the effect of drug treatment on a specific model. So, what is the conclusion? Has the treatment worked or has it not worked? In that case, you put the entire thing and then you try to do a meta analysis from the whole data and come to a conclusion. Outcomes from meta analysis are highly precise and they are statements which tell you a yes or a no. And in most of the cases, it is like the effect of treatment or a risk factor for a disease. Okay, rather than talking of individual studies, it summarizes the whole thing as such. Now, and since in a systematic review, when you are talking of heterogeneity, it is limited there. You talk of heterogeneity in detail based on the statistical analysis, and then you try to pool the various data and say, though in spite of heterogeneity, they all are together and they are similar. So having said that, this is the modified pyramid, which has meta-analysis as the topmost point. You start with animal research lab studies. You are going to case series, case reports. You're going to case control studies, cohort studies, randomized control trials, systematic reviews, and final are meta-analysis. So meta-analysis sits at the top of the pyramid and it is ultimate. When you do a meta-analysis and you give a conclusion based on meta-analysis, you are done with it. It will be useful for any clinical researcher to go ahead and pursue the next steps of the study. So, and if you see from year 1900s to 2000, as you can see here, the number of studies which are involving meta-analysis has increased thousands of fold, and hence meta-analysis has become a very favored method by which you do publish the systematic review. Now, what exactly is the difference between a systematic review and meta-analysis? If you look at it, a systematic review identifies the problem, it critiques the problem. However, the meta-analysis also does that, but it uses far more defined protocol. A meta-analysis is a refined version of a systematic review. Systematic review does not involve much of numbers, unlike meta-analysis where you have data analysis. Now, systematic review discusses factors that might explain heterogeneity. Meta-analysis as an extension does statistical studies which tell you why exactly the heterogeneity is coming. Now, systematic review synthesizes the knowledge. However, meta-analysis, it summarizes the results of that knowledge and gives you a clear-cut idea of whether it works or it doesn't work. So thus meta-analysis is like an add-on extension of systematic review and hence very much in detail. Now, this particular Venn diagram shows it. A meta-analysis is a part of the systematic review itself, or it could overlap with systematic reviews. So you can just publish a systematic review, or you can publish systematic review with meta-analysis. Sometimes you can publish meta-analysis alone also, but that will depend upon the researcher as what he wants and how he wants to do. All the options do exist. Most of the cases, it is like a meta-analysis is a part of systematic review. Now, so systematic review and meta-analysis have many things in common, which includes the way you write the introduction, the way you perform literature search and others. The only difference which comes with meta-analysis is the way you report the results. In a systematic review, it is a narrative style of reporting the results, whereas in meta-analysis, you do the analysis and you project graphs and tables for it. So here are the aspects with it. First, you define the research question, you perform the literature search, you select the studies, you extract the data, you analyze the data, and then you report the results. So this is standard like this, but there are few deviations in some points. Now, defining the research question is, in case of meta-analysis, is highly precise. Now, examples have been shown here. Now, when you are saying what is the effect of drug trastuzumab in adverse effects in cancer patients, that becomes more like a systematic review. But if you say what is the effect of the drug trastuzumab in having epileptic seizures in cancer patients, it becomes highly specific and is subjectable for meta-analysis. Now, the relationship between cervical cancer and long-term use of oral contraceptives is a very good question for meta-analysis, because you are talking of cervical cancer and the use of oral contraceptives. How they work and the way they work, both of them will make a very good sense, and hence it goes as a very good research question for meta-analysis. Then literature search. Yes, search includes Medline, Embase, CINAHL. You can get unpublished clinical trials from Cochrane Central Register of Controlled Trials. You can search Medline for general information. Now, the literature search for systematic review and meta-analysis are similar and identical, and hence the literature search flowchart, which I showed for systematic review, holds true even for meta-analysis. However, when it comes to picking up the specific papers, that's where you will get out the difference. Study selection is where you will have difference. The inclusion and exclusion criteria for studies have to be defined at the beginning when you are doing the meta-analysis itself, which holds true even for systematic review. But in systematic review, because it's a narrative style review, you don't need data in the papers. You can have or you don't have. But for meta-analysis, your inclusion criteria should be the ones which have data in it, because you are going to collect that data and you are going to use that data for your what you call meaningful interpretation. The various factors such as study design, population characteristics, type of treatment or exposure, and outcome measures, all these you have to look forth in the papers. We need values from the papers. Only then we can do meta-analysis. One should keep a track of the studies included and excluded at each step of the selection process, so that you don't go back to them and you don't talk about them again. Then, as like the PRISMA statement is for both meta-analysis as well as for systematic reviews. You have the quorum guidelines. Quorum is a dedicated, what you call a website or a database, which has provided guidelines as how to report meta-analysis and how to select the papers which are associated with it. Now, here is a study selection which has been shown for the quorum guidelines. You have, now this is an example from one of them which I picked from internet. So I'm just trying to go through the skeleton of this and tell you what it is. Some of the full forms I'm not aware of much, so you don't have to worry about them. It is from a clinical trial based perspective. So you have 7,557 records identified through various sources, of which 7,542 records are excluded by screening titles and abstracts, which makes it only 15 full text articles are eligible for the study, of which 5 are eliminated because either they didn't give the data properly or they didn't give the associated aspects clearly. Then the final included studies are 10 studies, in which 6 of them go for one aspect, 3 for another aspect, and 1 is a combination of both. Now, this gives a beautiful idea. It's like the PRISMA flow sheet only. This is how you do it, and that is how you work out with it. You have started from 7,557 records, and you finally found only 10 studies which are suitable for doing meta-analysis. So that explains how much of a rigorous screening needs to be done in order to pick up the best papers for the work. Then, as like systematic reviews, you need to have validity of meta-analysis. The results of the meta-analysis, even if they are statistically significant, doesn't make any sense. If you make results which are significant, but what is the use of it? Does it have a generalized meaning? As it is said, the results must have a validity or generalizability. The results must be applicable. So if somebody picks up like a clinical researcher, he must go on ahead with this meta-analysis and plan his next clinical trial. Now, in addition, the studies included in meta-analysis should also include patient populations that are seen in the clinical practice. So those patients who are involved in the clinical interventions have to be included in the meta-analysis as well. There should be a balance between finding the studies which are similar and those studies which are not similar, and then you pick up data from both of them and make your meta-analysis. You don't try to include highly similar ones, then the meta-analysis has no meaning. So you should go with some similar and some non-similar ones in order to avoid the aspect of being too narrow. As said, for systematic reviews, if you are very narrow, then you might lose out the generalizability and applicability of meta-analysis. So that has to be considered and kept in mind. Now, how do you extract the data for meta-analysis? Now, from each of the included papers, you pick up the study design, the descriptions of the study groups, the diagnostic information, the treatments, length of follow-up evaluation, and outcome measures. Now, then you have to make a framework. Again, for meta-analysis, there are dedicated softwares available online through which you can make it out. Like the templates for this are available from Cochrane. You have others from Covidence, Revman, and others, which you can use and simply extract the data in an Excel sheet or in Excel format, and you can utilize it very effectively. So having said that, analyzing the data, once you extract it, there are two important aspects which are associated with analyzing the data. One is fixed effects and other is random effects. Fixed effects means you consider that the true effect of treatment is same for everyone. You don't consider the effect of variables. You just fix the variable and you say the effect is same everywhere. Random effects is you consider the source for heterogeneity. You consider the source as why every study is varying. Now, Revman is the most prominent and most popular of all the meta-analysis softwares that are used. I personally like Revman so much because it is one of the best ones to handle. It is very user-friendly and you can make the graphs and charts you want. Most meta-analysis is done using the summary statistics, which represents the effect. And we will talk about how to plot it, and I have descriptions for it, so you do not have to worry much about it. Now, when you are analyzing the data, these are the available ones online, which include Revman 5, Metaphor, JASP, Gemovi. Then for Excel workbook, you have a meta-analysis format, which you can incorporate it as a plugin in the Excel. Then you have add-ons for it like Meta Excel and Meta Easy. Then other R packages you have, and you have a list of others. It is beyond the scope of this webinar to discuss all of this and to understand what each is. So I would request the participants, because you have a list, you pick up the best one you think you want. I would go for Revman 5, but if you are from backgrounds which are not from healthcare, you could pick up any one of others. However, one important point to be considered is Revman is the best one. It automatically performs the risk of bias. It's free of cost and easy to use. I could download it onto my computer without, any subscription hassles. But otherwise, I don't think they have made it commercial. You can check it out once. All others, like which are used for meta-analysis or meta-regression analysis, have a risk of bias, and that is something you can't help out with. So you have to go with the softwares which do not have the risk of, which can help you with the risk of bias assessment. Now, how do you report the meta-analysis? Yes, so you first give the title, you give the abstract, you give the introduction, methods, results, discussion. Most of it is similar to systematic reviews, except for the way you present the results. So I'm going to discuss about the results section of meta-analysis and how you go about with it. Now, when you are talking of results and meta-analysis, you have to present flowcharts. You have to give a figure which displays the results from individual studies and compares all the studies. It gives the source for heterogeneity. It gives the statistical data as well as the sensitivity of it. Now, meta-analysis typically is presented in the form of a plots. I am not going to discuss all the plots which are existing and which are used, but I will be talking about 5 major plots which have been used, which include the forest plots, funnel plots, bubble plots, Galbraith radial plots, and LAB plots. Funnel plots and forest plots are the most widely used of all. Others are not that widely used. Now, let us come to forest plot. Forest plot is like, it's the workhouse graph in meta-analysis. Anybody does it, they put forth a forest plot because it's easy to understand. Now, when we talk of the forest plot, it basically has certain ways by which it is done. Now, I can show you the forest plot, which is there in the next slide, and explain whatever is written here. This is how is a typical forest plot. Now, the studies are shown here, and you have what are called as these rectangular blocks. These blocks correspond to the number of what you call patients which have been considered for each study. The larger the sample size, the larger is the block. And so the particular line leans more towards that study. For example, this particular one is very small. This particular one is much larger. So the larger the sample size, the larger is the block that is assigned. Then at the end of it, you have a diamond-shaped quadrilateral, which talks about the confidence levels and the final assessment of the study. And you have odds ratio for each of the study, whether it can be considered or not. That's nothing but 95% confidence interval, which is nothing but a statistical parameter. Then the percentage weightage. And if you see here, for example, in the systematic literature review, as you can see, you have the negative axis and you have positive axis. Now, the odds ratio, so the negative goes for no treatment, positive goes for treatment. If you have more studies which have odds ratio favoring positive, then treatment works. If you have studies which are more going towards it, then the treatment doesn't work. That's how you interpret the forest plot, and that's how you get it out. Now, then the second one that you have are funnel plots. As the name itself suggests, it's a funnel. It comes in the shape of a funnel, and here funnel plots are typically used in order to understand if there is any bias in the selected studies when you are plotting them. Usually it's a scatter plot of the population size or size effect versus the study size. Now, I will not explain this too much in detail because you might find it difficult to understand. I have put forth the corresponding figure which makes it easy for the participants to see. If you see here, in all these studies, the funnel is perfectly symmetrical with hardly any deviations. In this case, the funnel is asymmetrical. You're not getting a proper funnel. This particular set of studies have to be deleted because they have a high risk of bias. When you delete them, you will get out a proper funnel. So funnel plots in that way help in analyzing and understanding the risk of bias. Then you come with bubble plots. A bubble plot, as it is said here, is again a scattered plot to study the covariate against effect size. So in this particular case, you have multiple variables. What is the effect of these variables on the population size? What is the source of heterogeneity? So you basically plot the size on the vertical axis, the covariate on horizontal axis, and like your Excel graphs, you have the line which passes through the origin, which explains the standard line. That's called the meta-regression line. This line is called the meta-regression line. You have studies which fall above and studies which fall below. The gray area is the area which shows the studies which fall in 95% confidence interval. And these are the studies which you consider. Other ones are deviating way too much, so you don't have to worry. They might be the ones which might fall in the bias ratio. Then you have Galbraith radial plots, which are again explaining what are called as, they are also the scatter plots, in which you take the standard deviation for the various studies and you take inverse value of the standard deviation. This is put on the x-axis. Then you divide the effect of the population size with the standard error and you plot it on y-axis and you draw a graph. Now, and you see which studies are falling near the meta-regression line, which are not falling, which are falling away from the line. The ones which are falling away from the meta-regression line are more relevant because the x-axis is an inverse log value. Now, if you can see here, this is a standard line. These are the studies close to, these are the studies which are away. These studies are more relevant because the x-axis is inverse value of the log standard error. So the further it is, the better is the study for consideration. Then you have L-Abbey plots. Now, this is a plot in which you plot the control risk group versus control treatment group, and you try to see whether it is matching and making any difference or not. And this is used for diagnostic screening accuracies as well as for understanding whether the treatment has effect or not. Now, this is the L-Abbey plot that you have. This is the line which of equality. If you have studies falling on this side or on this side, if they fall on this side, treatment is better than control. If they fall on this side, control is better than the treatment. And hence you can decide whether to treat or not to treat. So I am taking the plot per se as an example and explaining it. The participants are requested to go through the return matter later because explaining with the graph is far more easier than explaining it as such. So these are the standard plots which are considered when you are talking of meta-analysis, and any one of them can be used. Particularly forest plot is most widely used and will be done with it. Having said that, this helps us to understand about what is meta-analysis and how you do the results section. I come to risk of bias assessment. Risk of bias is traditionally defined as a systematic error or a deviation from the truth, which results in incorporating a false value into your data, or inference rather. Otherwise, it is defined as the extent up to which the design and the conduct of study are likely to have prevented bias. Now, risk of bias is basically where you are looking for, am I biased when I'm saying this particular statement or not? So the Robis tool or Revmen are the standard ones which are used for evaluating the risk of bias. Now, one example I'll give you here is this. For example, you have a set of papers here and you have the various criteria you are considering. Now, the plus means there is low risk of bias, minus means high risk of bias. Question is, we don't know whether it has bias or not. If you can see in all these studies, Clevenberg et al. 2002, and you take Ko et al. And Torti et al., they have a very high risk of bias across many of the parameters which are considered. So such studies you don't consider. Studies which have maximum plus, like the best one or the bossy one, can be considered. If it is a question mark which you have for some of them, you go ahead because you can't do anything about it. So it's again done based on the tools, and so you don't have to worry about it. So having said that, with this, we have covered the basics of systematic review writing along with the tools to be considered. We have considered the various ways by which you can analyze the statistical analysis in meta-analysis and how to draw the plots and how to do risk of bias assessment. With this, having said that, I officially finish this webinar on the concerned topic. We are here available for you for writing and editing services. In case if you have any queries related to the today's webinar or previous webinars, you can reach us at info@researchgraduate or at the WhatsApp number, and we will help you out. Then now the webinar is officially open for live question answer session. You please post your question in the chat box and I will help you out, in answering your questions. I'm waiting here for the questions from the participants. So please do post them and I will answer it back to you. First of all, a huge thanks for all the participants for complimenting us for the session we have conducted. So please do post the questions. I will look at them and answer it out. Yeah, Hishikesh Mahadev, as how he says, it's a good session, but so many concepts will take some time to understand. That is no doubt true. In fact, I didn't put forth some of the other ones because of the time constraint. So the whole purpose of this today's webinar is the participants go through these slides again and again and try to understand what has been said. You do the appropriate internet resource checkings, and then if you still have any queries, you can come back and ask us. Daniel has a question. How can you apply this to education? Yes, systematic reviews can be applied to education, Daniel. Like, what exactly are you looking in education? If you are looking for a specific type of a module of teaching, does it have effect on how students listen? You can do a systematic review or a meta-analysis, and you can get out the data and you can see if the module will help or not. Now, Rahul has a question. This is scatter plot. Actually, it is, see, Rahul, these softwares which they use, in most of the cases, the funnel plot is like a scatter plot only, no doubt about it. But you are changing the scatter plot in one of the aspects and looking it. Yes, no doubt true. You are partly correct. But then the way you generate the data here is using the specific software, and hence it is called as funnel plot, though it looks like a scatter plot. Vyomakesari T says, how to apply meta-analysis for a literature survey in literature domain. Now, if you are doing a literature survey, collect the whole thing. And as how I said, if you want to do meta-analysis, it is statistical. You need to collect the data. You need to collect the appropriate data points. And then you pick it up and you try to use any of the softwares to do it. It must be helpful for you. Now, Rahul says, you should have mentioned that this session is related to clinical research only. Rahul, that's what I said earlier also. It is not just to clinical research. Cochrane and Campbell Collaboration, though are similar, Cochrane and other websites are for clinical, but Prospero and all others are for non-clinical, non-health based ones also. This was never targeted only at clinical one. You please pick up the appropriate website and you can do the analysis the way you want it. So it is not just for clinical research. Daniel says, please, can we get a copy of meta-analysis article? Well, Daniel, we don't have to provide you a copy. If you are looking for a meta-analysis article on the internet, you'll get meta-analysis for healthcare very easily. In the education sense, I'm not sure of what are you looking for. You can get it when you use the MESH terms or the keywords, you'll get it. Now, Preeti has a question. Are the other softwares for free? That's a good question, Preeti. Revman, I know, is free. Others, even I'm not sure of. You just have to check if any one of them you want to use, because I only used Revman. Shruti says, can we include review papers for a systematic review? Unfortunately, the answer is no. You should have the systematic review addresses a very specific question and specific point. So general review papers are not applicable for systematic review. You need to have specific question oriented papers for it. Rahul says, is there a minimum number of reviews? Well, Rahul, the whole purpose to all the participants, let me tell you, the number of reviews is not decided by the researcher. The number of reviews is decided based on the PRISMA or the quorum guidelines. You download the sheet, you fix the inclusion and exclusion criteria. How many ever is the final number you get, that is the number of reviews which are considered. The number of reviews will not be a relevant question when you are writing systematic reviews, because it is not decided by you. It is decided by the protocol, whichever you are doing. Jasmine has the question, is this important to register on Prospero before writing the paper? Actually, yes. The reason is that in any of the websites, Jasmine, you have to register your protocol. The advantage of it being that when you register the protocol, nobody else will work and try to publish that, and you'll get validity of the protocol. If you don't have the validity for the protocol, then you are in trouble. So that's why it's essential that you register it. Then Muhammad, can we do only systematic review and not meta-analysis? Yes, Muhammad, you can do that. Meta-analysis is a subset of systematic review, and if you only have narrative data without any, numbers to be incorporated, you can go ahead. Or even if you have statistical data, you don't have to do meta-analysis. You can just do it. Dr. Vangara Anirudh, very informative and interesting session by speaker. Thank you, Dr. Vangara. Um, mm, Abdul Aslam says, can we use more than one quantity assessment tools in one study? You could do it. As far as I know, all these are interlinked, and hence when you feed in one, others will immediately help you and get it done. Now, Mosab, our time was working hours. There any record of the webinar? Mosab, you have a recording of the webinar, which will be provided to you at the end of this. You can go through that. If you have queries, you can write back to us. Now, Kuljit Singh has a question. Will you please explain how can I use it in the discipline of education? I think Daniel was another participant who had this question. Education is a broad term. Are you looking for any teaching modules, training modules, or any of the modules which can be incorporated to improve the knowledge of the students? Then you make it as a topic. Look on the web the appropriate sources, and then you can make a meta-analysis or a systematic review. Now, Hrishikesh Mahadev has a question. Which of these software should we use for systematic review? Well, it depends on which field are you. If you are from health field, I would say Cochrane. If you are from non-health field, you can pick up Prospero or any others. The answer for which software will depend on the field in which you are. Now, Ten Kumari says, is it for medical field? Yes, Ten Kumari, you have for health sciences. Health sciences includes the medical field as such. Then Ishani Shadukan says, how to do literature survey for management? Now, what exactly are you looking for in management? You look at it. You can use the MESH or the keywords and boil down and get down to the ones you want. Once you get it down, you look in the abstracts, titles, as well as in the introduction. If you have anything relevant, if you have it, you can go ahead and do it. Naveed Akhtar says, is Revman only for medical research? I'm not sure of it, but as far as I know, Naveed, that it is for medical research. You can just download it, or you can go to the Revman's website and see if it caters for whom. Or I think now Cochrane might have come up with modified versions of Revman which could be useful for others. Joseph says, how can you be applied this for education? I already answered this for others. In education, for all the participants who are in the field of education and who want to use this webinar, please go ahead and feel free to do that. First, identify the research question or keywords, collect the material, and then you do it, for which I need to know what exactly are you looking in education. Then next is Shibhu Valasan, PMP says, I'm from IT domain doing research on AI, artificial intelligence and machine learning. Oh, that is nice, because if you are doing that, you can even do systematic reviews in artificial intelligence and ML. I think you have a lot of them actually in Pubmed, so they could be helpful for you. Now, Prachi says, please tell some software for management and commerce too. Now, as I said, they are softwares like Prospero and Campbell Collaboration and others. As of now, few of them are only dedicated to health sciences, but the remaining ones have expanded their scope for other areas. So if they can do for criminology, social justice, humanity, I think yours also might be coming up. But if there is any specific one, they will only tell you, or they will guide you as how to go it. So Prachi, then you can look at it and get it done. Jairaj KP says, can we do systematic review without registration? You can do it, but at some point you have to register the protocol along with your paper. So what happens, Jairaj, is if you don't register it first and you do it, later on you might be asked to change your protocol because it is not validated, or that it might have issues. So you better first be prepared by validating the protocol, and then once you validate your protocol and you are sure that it is fine, then you can go ahead and do your work. Now, Gajendra says, can you repeat risk of bias analysis? Gajendra, the risk of bias is nothing but you have collected a set of papers. You have put in the inclusion, exclusion criteria. You got highly specific amount of papers for doing your review. But it could happen out that some of them are biased, that they support the notion that this particular condition treatment doesn't work, and some say treatment works, and you can't make out because they all look good. So when you feed the data and you draw the funnel plot, you will get to know based on the shape of the funnel whether it's a symmetric funnel or asymmetric funnel. If it is a asymmetric funnel, then the papers whichever are contributing to it have to be removed such that the bias is removed. Then now, Gajendra says annotation not visible. You will get the slides for the lecture. So I think when you put it on your laptop and you look at it in detail in the full screen, you can get most of the things, because when we are presenting it here, some of the things you might not find it clear. Yes. So then Shruti says, can we include review papers for a systematic review? I think I answered this already, that it depends. All the review papers cannot be included. If they are specific and they are for your question, then you could work it out. Yeah, Nana Yaw says, please, I am from IT background and have a challenge in my research. I'll be happy if you could help me with the expert direction. Yes, so you please contact Tejaswini, or you can WhatsApp us, or you can post an email to us, and then we will see what best we can do. Then Sajan says, thank you very much for the information. Do we need to present a separate Prisma flow diagram in meta-analysis? Yes. Actually, the first figure of your, no, actually, if you are doing meta-analysis or you are doing systematic review, the first figure is Prisma flow diagram. So if you are following the quorum guidelines, it's identical to the Prisma one. So most of the journals expect that you do it in a Prisma format only. Navendu says, can I integrate meta-analysis with qualitative descriptive study? You could do that. Now, the qualitative descriptive study will be your systematic review. Then you can integrate it with the statistical analysis, which is nothing but further meta-analysis. Now, Preeti says, how many papers have to be reviewed for literature survey? Now, as I said, I can't, means for this particular topic on the systematic review, for all the participants, no participant can decide how many. If you see the examples, we start with 370 or 7,557 papers in one of them, and finally you landed up with 10. So because of the criteria fixations and for the way it works out, so that's why it is like that. So you have to follow the protocol. So here collect as many as possible, because some of them are not even suited. Now, Shruti says, good sessions. Would you like to know if you have any idea about library for animal sciences and ecology? Animal sciences and ecology, there is one which I have put in along with the website's list for quality assessment. That's for ecological or environmental evidence. Shruti, I think that could be helpful for you and useful for you as such. Case Ilango says, demonstrate Rev Manager because I tried year back. Now, actually, demonstration per se can't be done here. I would suggest you have a demo tutorial for Rev Manager. You just see how to use it. You download onto your computer and you utilize it. You'll get to know it, how to do it. Shibu Vasalan PMP says, can you please provide some of the reference sources? Now, I have put in for the reference sources, particularly are Embase, Medline, then you have got what do you call Cochrane and others. There was one Venn diagram figure we showed for so many of them. You can just pick up one of those and you can use it. For all the participants, a kind request. If you were finding that there was a lot of data in the today's slides and it's taking time for you to sink it in, I would request you please go through the slides again and again when you have free time, and then you will get out the whole thing. The main purpose of today's presentation was to compress and present it in one shot so that you take time to evaluate it, and then even if still you have questions you can come back at that time, because I see some of them saying that because of the time constraint, as there was so much expressed here, we couldn't understand some of them. So we are open for your questions at any time. Bilal says, can we add the literature review of our synopsis and thesis too? Yeah, you can add it, Bilal. There is no problem. Then Muhib says, can we take data from systematic review and write meta-analysis on it? Well, but then you can't take the whole data. You can take only the data which has got the concerned numerical points which you want for statistical analysis. Only see systematic review, if it has say 20-25 papers, meta-analysis will only have 15 or 20 papers. The reason being some of them are only narrative and they don't have. So only you can pick up those selective ones. Suhas has a question, how we can find genes using meta-analysis? Well, that is a different aspect in itself. So you take out the various meta-analysis done in biological perspective for the various aspects you're looking. From there you summarize and get out the genes. Rishikesh Mahadev says, for climate change, which website to register? There's one environmental evidence website in one of the Excel sheets, in one of the presentations for today. There is the quality assessment or so. There you have one environmental evidence website for reviews. So please see that if it would be helpful for you. Then Rahul says, is this session applicable to management students? Yes, the protocols and the methods are same, irrespective of whether you are a science student or management student. The problem for me is that when I try to prepare the slides and I'm collecting from internet, bulk of them are from clinical trials and medical background. That's why you get those. I don't get for management much because it constitutes of a very small fraction of. Sushma says, please tell software useful in management and commerce for systematic review and meta-analysis. Now, for all the participants, I have that list provided there. Please check it out and see whichever is applicable, because it is not in the scope of this that I could go through all of them and make slides. That will become too much and we can't cover in the given time. And anyways, once I give you the information, it will be of great appreciation if the participants can do some of their basic research on that and get out whichever is relevant, because it is not possible to cover for every participant at every time as they are from diverse backgrounds. Krishna Kumar P says, how or what kind of help do you do in case study of research approach? In a case study of research approach, what exactly is that you want? You write a query to us, then we'll see how best we can help you. Ravindranath says, what are the main contents to have in a research paper? Ravindranath, we have done research paper writing and review paper writing webinars earlier. You can go to those and you have all the details that you want in those. Ashmita Patel says, is meta-analysis come under original research paper or review article? Meta-analysis comes under systematic review articles. It is, meta-analysis is not considered an original research paper because it is data of someone else which you are using for making meta-analysis. Jasmine says, is this important to register on Prospero before writing the paper? Yeah, preferably it's better you register. Otherwise, if your protocol is not valid, your paper is rejected, and again you have to make it properly. So you better register it and go it in the systematic steps as how we have explained. Jairaj, yeah, if any of the participants question, if I'm missing or I'm not finding, please repost it and I will answer it back to you, because I see many of the questions now are repetitive and I have already answered them. Payal says, please suggest some software related to finance background. If that's for the management, means I am not sure of it, Payal, but from the list, whatever we have tried to compile and make in the Excel sheet, see if anything can be useful. Arup Bish says, can meta-analysis used in new media? Yeah, in news media you can use it because they make so much of data. You can compile and make it out as one thing as such. Then Ishani Sadhukan says, literature survey guidance for management stream. Yeah, just go through those and see if you have any, and that could be helpful and useful for you as such. Navendu says, can I include a single case study into a meta-analysis? No. Answer is no, Navendu. You need multiple case studies for doing it. Well, also it depends on what exactly is the case study, what is the population size of the case study and others, but you need more than one, that is for sure. Uh, Navendu says, can we do meta-analysis with one-way F statistic in RevMan? Now, well, that is so statistical that even I don't know. Just open the RevMan catalog or their PDF browser and see if you can. Otherwise, download the RevMan for free once and see and try if you can use it. Mm. Vijay says, which software you suggest for power electronics for systematic review? I think they will come in the management or related ones. Of the so many softwares I suggested for quality assessment, you can use some of them for it, Vijay. Now, Shiludi says, best app for checking plagiarism? I am not sure of. Grammarly is one good one, but plagiarism we have elsewhere covered in our earlier webinars. You can just look and get links from there. Now, Vyoma Kesari T says, sir, is meta-analysis a statistical method of doing the very manual way of literature survey? And is SR meant for qualitative and MA meant for quantitative? No, actually, it is not a manual way. If you are thinking so, it is wrong. Now, when you are doing traditional literature, you do the manual way. But when you are doing meta-analysis, you are collecting each and every data point and you're trying to put it and do it out. And hence, it is very different. So they are not exactly the same. The second point you said is correct. SR is for qualitative and MA is for quantitative, no doubt. But it is not like your traditional one. Geeta Kochar says, please suggest software for MI and DL for systematic review. I think it's for machine learning, you mean to say. Now that you have to look in, if you have any, because most of them are for wide fields of health science, management, humanity, and others. Do you have any for it? Even I am not sure of. Respected sir, why can't try like this in management, Ten Kumari? The problem is that we don't know if you have much in management or not. So when we make webinars, they are for broader participants, and hence maybe that it is like that. So be using this as a template, I would suggest if you can try to look for appropriate ones in management. Abdul Salam says, can I share my protocol for systematic literature for your input before submission? You could do that. But I will not be the perfect person to do the quality analysis, because whatever softwares we have, sometimes they are not up to date. You can provide us, we will try to feed in and see whatever best we can get it, and we will give you an idea of whether it is fine or not. Shruti says, hello sir, how the pyramid of systematic review be used in animal science or ecology? Yes, the same way as how it is for other Shruti. There is no much of a deviation in this part. Now, Ganga says, very informative session. Can we use published systematic reviews when we are doing a systematic review? You can probably use them, but then yours will become an umbrella review because already systematic reviews are existing for that particular topic. Now, Dr. Samir Barve says, can we use Scopus or web body science for systematic review data extraction? You can, but they are not specific databases, Dr. Samir. Whatever we have suggested will be easier for you as such. So, having said that, I think we pause with the question and answer session live here now. Points to be noted before I end the webinar. The participation certificate will be emailed to you tomorrow at 5 p.m. You will get the recordings by 2:45 p.m. today. Then a huge thanks to all the participants for attending the webinar. Now, if there are any queries or questions which we have not answered, or we have forgotten to answer, or we missed it out, please do mail to us and we will do it. If you have any specific topics or any others which you want us to have incorporated as a webinar, we will be more than happy to make it, but then we will need time because it takes a lot of time to make one webinar series. So, we have attached the various references which have been used for this. You can use them also simultaneously for your consideration. A gentle request to all the participants, please go through these slides again and again when you have time. It will be of great importance and useful for you. Once again, thanks for attending the webinar and making it hugely successful. We hope all of you have liked this, and then we wait for your constructive inputs and your compliments for this webinar. See you at the next webinar. Thank you so much for attending it and have a nice day.